Do you get shoulder pain when you reach behind, lift something, or sleep on the shoulder? Maybe it is a dull ache that becomes sharp as you do the movement and it becomes weaker every time you lift something. In this video, I'll show you 5 exercises that will improve the shoulder strength, mobility, and decrease your pain. You will need only some resistance band or dumbbell, or you can even do without it if you use a body weight. If you're new to this channel, please subscribe because this kind of content is going to be on regular basis. Also, please check the safety disclaimer that if you have a shoulder injury, trauma, tear or fracture, please visit your healthcare professional. This video is only for education purpose only. So let's check what exactly the rotator cuff is. Rotator cuff is a 4 muscle group and it is providing the shoulder joint stability, which is called glenohumeral joint. Most of the pain comes either strain, overuse or overactivity in the shoulder muscle groups, and it can turn into tendonitis or tendon tears. This usually caused by poor postures, poor mechanics, and repetitive trauma. Now, good news is that shoulder rotator cuff injuries responds well with progressive strengthening and mobility exercises. We will start with the gentle movements and muscle activation, then start with the strengthening, and then finish with the functional patterns that we use on a daily activity. So next few exercises are going to be based on the progressive shoulder strengthening exercise program. The key is to work with the comfortable and tolerable pain level, and if it becomes sharp means we need to decrease the load or decrease the repetitions. So exercise number 1 is a pendulum swing. Pendulum swing is designed to help the shoulder joint deload and relax and create a traction in it. It's not just a simple movement. It works with the biomechanics of the shoulder as well as how the proprioceptor works in the shoulder to relax the muscles around it. So what we do here is a stand with the support on the either kitchen top counter or a table, and then you're going to put one hand on the table to support and lean forward, and then your right side, if you're doing on the right side, is going to hang, and you can use the same leg to step back. Let the affected arm where you're doing exercise relax and dangle, and then you're going to start with this motion. So then gently let it swing your arm that is affected or you're doing exercise with, and then let it relax. You're not doing this actively. Make sure there is no active muscle work going on here, because then this exercise becomes not really useful for our condition. We're going to do gentle 10 circles clockwise, 10 circles counterclockwise. If circles are painful, you can just go forward and backward and finish the motion, and then progress with the circle eventually. So this you can repeat 2 to 3 times a day, 10 repetition on clockwise, counterclockwise, and you can do morning and evening, and especially in the morning time when your shoulders are pretty stiff, this can be done easily, and this will help mobilize the joint as well as relax the muscles. With the exercise number 2 is the external rotation with using the bands. So here we can use either resistance band or tube bands to add some resistance. We need a mild resistance, and this is the one of the rotator cuff muscle strengthening exercise. So how we are going to do is, you can use the resistance band or a tube band, attach one end of the tube to the stable areas or a hook or a doorknob. The second end we are going to hold using the hand. We are going to make sure we keep the elbows tucked with your body and elbow 90 degrees bend. How we are going to start with this exercise is, we are going to keep shoulder blades stable, and then we are going to pull this away, and then we are going to rotate outside. Once you do this, you will feel the weakness in the muscle. Your shoulder muscles are trying to feel and fight with it, but they will feel weaker. This is one of the weakest muscle in the rotator cuff and also prone to injuries. So you don't want to have too much resistance. You can do 10 repetitions, 2 to 3 sets based on your tolerance. Okay, once you're done, make sure you take a break in between. You don't need to do multiple times a day. This is easy once a day exercise, but with comfortable resistance. Now exercise number 3 is the scapular squeeze or scapular stability exercise. We have a scapular muscle that is the stabilizer of the shoulder blade as well as the shoulder joint. So we need to activate them when we have a rotator cuff tear or injuries or overuse. So what we are going to do is we are going to either sit or stand nice and tall, and then we are going to squeeze the blade. So you're bringing the both blades together. Imagine there is a pencil between the two blades and you're trying to pinch it, and once you pinch it you can hold for 10 seconds, and we are going to repeat for 10 repetitions. So this exercise Exercise number 4 is a sideline external rotation. We did with the bands. Now we are going to use a dumbbell. You don't need a heavy dumbbell for this exercise because this exercise is again weak muscles. You're doing in a different angle only, so it's technically similar motion. So you're going to lay on your side with the affected arm on top. So if your right side is affected, it's going to come on top, and then we're going to keep elbow tucked in. We're going to use 1 or 2 pound dumbbell. You can hold it and then you're going to rotate outside. This is one of the exercises we do on a regular basis with patients who has a lot of pain and can't do the bands as well. So if it is painful, again you need to decrease the motion, decrease the resistance, or just use no resistance, right? How many reps? 10 to 15 reps, 2 to 3 sets, once a day only, within the pain limit. So exercise number 4 is the wall side. This is one of the good exercise you can do when you are feeling really tight, stiff, but less sharp pain. So what we are going to do is you are going to stand against the wall with your back on the wall. We are going to bring the elbows against the wall and then make a W position like this. Then if this side of your wrist don't touch the wall, it's okay. If your shoulders are tight, don't force it or create more pain. We're going to keep it there and we're going to slide up as much as it's possible. Once you do this, you will feel good stretch in the front as well as muscles activating in the back. That's all we need. We need 8 to 12 reps in the morning, evening times. This can be done as well. This can be also done on the floor as well if you are feeling comfortable that way. Okay, now once you progress with this, you can make sure your arms are touching or hands are touching on the back wall and you're sliding comfortably and improving the range. This is one of the functional motion we use to do most of the activities like this, right? So to do the recap, we did 5 total exercises, and this exercise is combination of movements, strengthening, as well as functional patterns. So we are going to do this 5 exercises in this order. Pendulum swing in all direction, 10 repetition each. 2 to 3 sets of 10 to 15 reps of external rotation with bends. 2 to 3 sets of 10 to 15 scapular squeezes. 2 to 3 sets of 10 to 12 sideline external rotation per side, and 2 to 3 sets of 8 to 12 wall slides. Important tip is start 1 to 3 exercises if you are in early stage or your shoulder is painful, because this will help decrease the pain, same time help the recovery. Once your pain reduces, go for 4th and 5th exercise, which is also functional movement and more strengthening, and you can increase the stability. Now make sure you keep your pain level 10 out of 10. So make sure you keep your pain level around 3 out of 10 on most of the exercise. If it goes more than that, that means it's a problem. So any of these exercises helped you and you felt good with it, please make sure you let me know in a comment section. It helps me to also design better exercise programs in the future as well. So if you have a question, please let me know in the comment. Otherwise, I'll see you in a next exercise video. Thank you.